Dr. Adam Davis here from South Georgia Spine and Joint Center, and I wanted to kind of talk to you about personal injury type cases this time. So in the past, we've talked about, many conditions that a medically integrated and regenerative medicine facility can and provide. But when it comes to personal injuries, we see a lot of accident cases. So whether it's a slip and fall, motor vehicle accident, those are the ones we typically see. The process of that is interesting with a medically integrated regenerative medicine facility. So today we're going to talk about kind of what we do, how we can utilize regenerative medicine and a medically integrated facility to help speed up the process of someone who's injured, get an idea. Usually personal injury cases come to us from a specific lawyer or maybe a workers' comp type case. They go through their process with their legal stuff. Then that lawyer sends them here for treatment. That's kind of how it works. So with South Georgia Spine and Joint, we've been doing this, almost 20 years. We got a pretty good idea of how to treat personal injury cases, because when you're talking personal injury, there's a whole gamut of problems. You're talking whiplash, which is a common one in the neck, just low back pain, stiffness, inflammation's a big one. A lot of times we'll see fractures, we'll see bulging disc, herniated discs, things like that. So there's a multitude of things that go into a personal injury case, and some of that is getting with a team such as South Georgia Spine and Joint and utilizing the brains of the medical team, the physical therapy team, and the chiropractic team to come up with a specific way to treat these acute problems so they don't lead into major chronic issues. So we'll talk about all that today, each department, kind of how we assess, get an idea of how personal injuries work here at South Georgia Spine and Joint.
So the very first thing that happens with a personal injury case, when they come into our facility and they fill out all their paperwork, get an idea of what happened in the accident, they come into a room such as this and they do a detailed evaluation. So we do this on all patients for any condition, but with personal injury, we know a lot of times they're going to come in with major pain issues. So, in a regular case of back pain and things like that, patients can kind of deal with it a little bit to an extent sometimes, and it's kind of there, and we got to figure out, the right treatments. But with personal injury, a lot of times people are coming in with what they call antalgic positions, where they're leaning to one side, leaning forward, real stiff neck, kind of move around like that. So we kind of already know we're going to see that. But the very first and most important thing is to do a detailed evaluation that gives us an idea of, before we even take x-rays and meet as a team, what are the presentations that we see? And so mainly we're looking at, one, do the nerves work? All right, so anytime there's an accident, you can kind of jolt the discs in the neck and the low back and get an idea, is there a nerve problem? That's the first thing, because there's a whole array of treatments and combinations of things we can do if it actually is a nerve problem. So a lot of times we'll do an assessment to test the nerves. We're checking reflexes with like a reflex hammer here. We'll check to see, is everything going well in the knee and in the, and it gives us an idea of the feedback mechanism to the brain. Are the reflexes intact? That's the first thing, and that tells you if some things are working right. We'll do muscle tests where all these nerves come out of the neck and go down the arm to the hand and different muscles. All the nerves that come out of the back go all the way down the leg. We'll test this strength to kind of see, are you even on both sides? So if that is the case, and I see this a lot, if the nerves are even in strength on the both sides, and that's telling me that the nerves are actually working, but there may be a problem of where the nerve comes out. The origination, the nerve root is what they call. And that's a spinal problem a lot of times. Or if there's a major nerve injury, meaning, you're weak on one side and strong on the other, then we can kind of integrate with our medical team to get a better idea of how we can treat you, since there is that nerve problem. So that's the key, is finding out, is it a nerve problem or is it a nerve root problem? Are there what called radiculopathies? Does it go down the arm and into the hands? Does it stop here? Does it stop here? Same thing with the low back. Is it radiating down to the knee? Is it going all the way down to the foot? These are all the presentations and things that show us how to treat someone who's been involved in some sort of accident for a personal injury case. We do an array of orthopedic tests. So there's literally like 10,000 orthopedic tests, right? But we choose specific ones based on the history of talking to the person. So, they'll say, I was in an accident 2 days ago. Instantly, we know it's an acute problem, not really a chronic problem. So we know with certain, techniques and orthopedic tests that we may see a lot of flare-ups and inflammation, So there's some for the neck where you can determine, hey, is it a ligament problem or is it actually the joint? So there's a ton of things we sniff out when we do certain orthopedic tests that says, and we write it down, could be possibly a disc problem, could be possibly what they call a facet problem, where the joints kind of meet and line up there, where the movement happens. Is it just ligamentous and tendon? Is it inflammation? There's a lot of things just with the orthopedic tests and some of the specific tests we do that can determine which road we're going down, and that's what we do before we take x-rays. It's a very detailed assessment. We need to know, do the nerves work? We need to know where is the problem, sniff it out, get an idea. That way when our medical team meets with our physical therapy and chiropractic team, and after we've taken the x-rays, then we can sit there and talk about those presentations we saw, when one of us did the assessment. So with x-rays, that's another thing that we'll end up taking with a personal injury case, okay? So, you can't go blindly into a treatment without knowing what the presentation of the spine looks like. It's not the safest thing. And legally, a lot of times we need to do that. So, when we take someone into the x-ray room, we're taking an array of x-rays. So for instance, if someone just has low back pain, they weren't in an accident or anything like that, we will kind of just focus on their pain and where their issue's at. So it'll be just low back x-rays. But with personal injury, there's a lot of things that happen. You might get hit in an accident tomorrow and not have pain for a week. Then all of a sudden you start getting that stiffness and that pain. So we'll take an array of x-rays from top to bottom. On the neck we'll take, cervical spinal, sometimes we'll take 5 to 7 views. And it's not just static. We'll try to get ones where you're kind of extending the neck and flexing the neck, because what that shows, if there's major ligament damage, sometimes some of those vertebrae will shift and kind of be out of place. And that sniffs out, based on what I saw in the exam, I did that orthopedic test and it lit them up. Their nerve's a little weak on that side. And now we look at the x-ray and we show, wow, there's a lot of instability in that spine. Those are all the things we put together so we know exactly how to treat you. So with the x-rays, we'll take different views of the lumbar and the thoracic and the neck for that reason. All right. And the most interesting and best part about using a regenerative integrated medical system is, after we see them and we take the x-rays and we write all our notes down, we'll meet in a room such as this, and we'll literally go around the room. We'll have the medical team, medical doctor, nurse practitioner. We'll have the physical therapist, one of the chiropractors, and we all sit in a room and literally nitpick how we're going to treat this person. So we'll look at the x-rays, we'll bring them up. I or someone will kind of go over the history, everything that I found in the test. They were weak here. This orthopedic test was positive. This one was negative. Their range of motion was limited here. And we literally go around the room. Medical doctor, what do you see? What do you think they need? Physical therapist, what do you see on the x-rays? How would you treat them? What would you focus on in a therapy session? And how would you progress that? Chiropractic, what techniques are going to be best for this person? Based on their presentation. So once we put all that together, it's so detailed that most personal injury cases here at South Georgia Spine and Joint get better within 8 weeks, and they do pretty well because we know exactly how we're going to treat them because of this meeting that we have and because of the details that we've taken in the tests, assessment, and the x-rays. So let's kind of snip out here how chiropractic can help, and start with that. So one of the biggest concerns for personal injury patients is, what's the chiropractor going to do to me? That's what I hear that a lot, and a lot of these personal injury patients have never been to a chiropractor before. So one of their biggest concerns is, oh my God, are they going to put me on my side and kind of adjust the neck and do certain things like that? Well, there's a lot of research on acute versus chronic injuries and things like that. So the interesting thing about a personal injury case is, some of the research does indicate adjusting during acute problems can actually be very beneficial, and it's actually kind of warranted sometimes. So it kind of depends on the presentation of the person and what their injuries are. But more times than none, what we found out is if we're a little more conservative in the acute phase and then progress to a point where the pain gets down, the inflammation gets down, and then you can start doing a little bit more adjusting and manipulation, it seems to work the best. Now, like I said, every case is different. So as professionals, we'll know what you should and shouldn't do based on the presentation and the meeting we have and all that stuff. But a lot of times with personal injuries, and this will kind of make sense, the joints need moved because that's what's being stiff from the injury. I mean, sometimes there's actually injuries to the joint and you're not going to want to adjust anyway. However, if there's not major issues, sometimes people can get flared up from adjustments. And here's why. Because with injuries, it's not just a joint problem, it's a muscle and ligament problem. All right, so in the case with whiplash, that ligament is highly inflamed, especially in the acute phase. So now all of a sudden we go in here and we adjust the joint, which is warranted in most cases because the joint's going to respond well to that. But the tendon didn't like that. You see how that works? And the muscle didn't like that. So sometimes it raises the pain of someone that's coming in, and that's what we're trying to prevent. Get them comfortable so they can start getting better. So with chiropractic care, a lot of the times it's a lot of stretching and what they call decompression. I've done videos on decompression and opening up the spine, and it's like the stretch, and you do light drops on the pelvis. But early on, that's kind of how we do it. With most cases, like I said, certain cases you can adjust, it just depends. But it really helps and really gets people better a lot faster when you don't re-inflame the area and you ease into it, because they're already doing physical therapy as well. They're seeing our medical team, so they're doing a lot. But just rest assured, you come into South Georgia Spine and Joint, that's kind of how we approach it. We really are particular to the details in the assessment, in the x-rays, in the classic presentation to know exactly what stretches, what adjustments, if an adjustment at all, is going to help you early in this treatment process. So with chiropractic, it's definitely a critical piece of the puzzle, but it's different for every single person depending on the condition.
We've talked about physical therapy and many other videos about any condition. We know for a fact with any condition, it's not just a joint problem, it's also a muscle problem. It always is. That's just how the body works. But with physical therapy, and you're talking personal injuries, this is where it gets even more critical when I've talked earlier about acute versus chronic injuries. There's a whole set of protocols with acute versus chronic depending on how bad the situation was. Like we've seen people who've been hit head on, flip the car, God forbid, or just getting hit from the back but not seeing it's coming, and then that kind of gets jerked and get whiplash. I mean, there's a lot to it. But physical therapy is excellent for any condition, but with personal injury patients, it's even the most critical point, because these people are, one, trying to get out of pain and reduce the inflammation, but they want to get back to their lives where they're not having the inflammation and the pain and they're functioning better. And that function is lost a lot of times with, accidents. So it's very critical with physical therapy. But what they do a great job with here in South Georgia Spine and Joint is seeing if it's an acute or chronic issue. With an acute, there's a lot of specific soft tissue techniques, a lot of specific exercises early, in an injury, and modalities. E-stim and TENS unit, heat versus ice versus heat, things like that. A lot of times you might do ice, you might do heat later. It just kind of depends on the condition, but knowing what phase of healing you're in, what phase of the process you're in, acute, subacute, into the chronic phase, it's very indicative of exactly how the physical therapist is going to approach that. So once again, they're going to do a detailed evaluation on, not just from the chiropractor standpoint in medical, but from their own standpoint of muscle tension, understanding, is this muscle underactive? Is this one overactive? Is it really a nerve problem? So the chiropractor is going to do that whole big exam in there and check the nerves, but they also do a great job of that as well. So they're going to look at it a different way from a movement, muscle standpoint and get even more information. So that's kind of how it works. So that progression for 8 weeks, we always do about 8 weeks with personal injury patients. That progression, 99% of the time the personal injury patients get out of here and they're feeling great. And it's because of that progression, that understanding of, hey, I know when you came to us, what phase of healing you're in. And if it's an acute phase, there's a whole different protocol compared to someone who's 6 weeks into their treatments. So putting that together is one of the most critical things to getting better faster and calming down that inflammation and getting things to function better. And that's the whole point. So with physical therapy, it's very critical that they do their own evaluation, get an idea, and stack it with the information that's already provided by the chiropractor and the medical team to come up with, here's the progression we're trying to do for 8 weeks to get them back to where they want to go. So when you come and see our medical team, we already kind of know what we're going to do. And because of that, we've had that meeting like we've done, and we know exactly, here's where the problem is, here's the inflammation, we've seen the x-rays. A lot of times we'll end up getting MRIs, okay? So like we said, the x-rays kind of show bone, and they can show certain presentations of alignment and what degenerative changes, fractures, things like that. But it doesn't show a lot of soft tissue or nerve, problems. So with most personal injuries, we'll end up getting either a cervical or lumbar MRI, or depending, maybe it's a shoulder, whatever it is, knees. And that'll be a lot more definitive of exactly what the problem is. So we know what the problem is from the accident standpoint of the x-rays and the exam, when we know there's the problem here, the nerves are working, but it's not good on this side or whatever. But now we take it one step farther. You get the MRI. Now it literally pinpoints. Here's the exact problem. Here's what it is. And here's where it is. So now our medical team steps in and does a fabulous job of helping down-regulate that inflammation so they know exactly where to go. With regenerative medicine, and I've explained this a lot on other videos, one, we're trying to prevent surgeries and we're trying to prevent long-term drug use. It doesn't make sense to get this person functioning better. So you want to use a lot of your own innate abilities of healing, but just help it along the way with some of the more natural ways you can do this. And that's what our medical team does. They're certified to do all kinds of cutting-edge techniques that can help regenerate the problem and solve the problem the most natural way. Another thing that they can do is durable medical equipment. So we provide that to all of our personal injury patients, taking home their own TENS unit and back braces. Those are the types of things that help so you don't re-inflame the problem. Think about it this way. With personal injury, the reason why it's so difficult and it's so tough is this person's never had to adapt to this pain because it's so acute. Someone with low back pain, they've had it for 10, 20 years and they're like, well, I'm just doing something about it now. Hopefully you won't do that. But if you get to that point, you've been able to sort of compensate and understand what you can and can't do. These people are your just normal people, mothers, fathers, grandparents, cousins, people that have kids, people that work. Some people, I had a guy, just about a month ago, he's a construction worker. He's the breadwinner for his family. So he's a 10 out of 10 pain, just was in this accident. No one else in his family works and he has to work. So think about that. He can't just sit at home and not do anything because he has to provide for his family. So personal injury cases are a lot tougher because they still got to live their lives and still get paid and still provide for their families and do the things they need to do. That's what makes it so tough. That is where the medical team is tremendous. So having an MRI, knowing exactly where the problem is, we can downgrade that inflammation in day one if we can get them in. We schedule it out and things like that. But if we can get that inflammation down, you can drop that pain level significantly and give them the relief they're looking for. With the durable medical equipment, they can protect the spine. So when they got to go do these things at work and do the things they got to do to live, having that back brace, is great at preventing re-inflammation. If you're trying to solve a problem and they're going from a 10 to a 9 to an 8 out of 10, 7 out of 10, you don't want them to flare themselves up and they come in 4 days later and go, well, now I'm a 10 again. That's what that back brace and some of the durable medical equipment can do. Knee braces, things like that can kind of help stabilize the area so you don't re-inflame it when you have to live your life. See how that works? So, like I said, everything we do here is uniform for every condition. So this is kind of how we do it for everything. But with personal injury, it makes it even more critical because there's very specific things from acute to chronic to how the presentation is to if the nerves are working. That all comes into play. And having that integrated meeting for regenerative medicine shows us exactly how we're going to treat you, and everybody's on the same page. And what happens is you get better, and after 8 weeks, we send everything to your lawyer and done deal. So it's a pretty easy process as long as the person shows up. So that's what we do. We do care plans with people to get an idea of when you're coming. We schedule it out, 8 weeks, so you know exactly all the dates, where you're going. You're seeing medical this day, you're seeing physical therapy and chiropractic these days. So there's no confusion. It's a pretty easy process, but it just takes time to get better, okay? For a personal injury patient to get better, you have to show up and you have to get treated, and we try to see you about 3 days a week. So if you can do that, and you can do these things and you're approved for get all these treatments, there's no question that's the ultimate combination. And that's one of the only ways you can really truly get functioning better, okay? We're trying to solve the problem, regulate the inflammation, get you back to your life. And it takes regenerative medicine, medically integrated approach so that every department's on the same page to get you better. And we've had great success with doing it. We've been doing it, been around about 20 years. So at South Georgia Spine and Joint, personal injury is something that we take serious, and we have been doing it so long, we kind of know how the process works and what works and what doesn't. So if you've been in an accident, or you've been in an accident even possibly a year ago, and you got a chronic issue, if you've had a slip and fall at work, obviously get with that lawyer, get with that workers' comp representative. But if they can refer you to South Georgia Spine and Joint, we have what you need to get better. We got everything under this roof that can literally get you to where you need to go. Or if it's something that's even more serious, we know who to direct you to. So anytime, if you know someone that's been in an accident or whatever, give us a call. Have our lawyer or your workers' comp give us a call. We know we can help you. We can get you better for sure. So for South Georgia Spine and Joint Center, this is Dr. Davis. And as always, don't just manipulate, integrate.